Hey guys, it's Dr. Yazdan. Today's case is a woman hair transplant, female hair transplant that we're doing today. And a lot of people don't realize that women lose hair as well as men. And I think, in society, it's probably a little bit more socially acceptable for men to be losing their hair. They shave their head. But if you see a woman who is thinned out a lot or losing their hair, it seems to affect them really quite a bit. And in our practice, we're probably about 35-40% of our patients are women, and the remaining men. And so we do a lot of female hair transplant surgeries. Our patient today has been seeing me for probably about the last 2 or 3 years, and I've been managing her hair loss with medical management, but it's gotten to the point where it makes sense to do a hair transplant to kind of fill everything in. So we're going to be doing a strip FUT surgery today on her, and we'll have you guys follow along to kind of see how it goes. We zoom in, we'll bring the camera in, and you can see that she has quite a bit of thinning here in the crown. It's just her hair is thinned out over the last couple of years. We've done pretty aggressive medical management, and it's probably slowed it down a bit, but this whole area is just thin. And so what we're gonna do is essentially fill this in so that she gets more density and fullness through here, and can wear her hair in a way that it will cover some of this as well. And patients who have diffuse thinning like this, it is more difficult to fix and get fullness everywhere. So we have to be selective with how we're going to use the grafts and do the transplant in order to maximize the coverage and get the best overall result. So we're going to get the procedure started. I've kind of looked at how we're going to plan the surgery out and what we're going to do, and we'll get going. So we've harvested out the strip portion, and what we're doing now is I'm closing this up. I do the closure with sutures. I think that it ultimately comes out better. It takes a longer time to do, but we're not trying to rush this. We're trying to do it as best as possible. So we'll close this up, and we'll show you guys how the final incision looks. Now what'll happen is her hair is going to drop down and cover this incision. So you're not really going to see it at all. She won't see it when she leaves the office. And once all the hair grows in and hair grows through the scar, it'll be really hard to find. I mean, she'd have to shave her head to really be able to ever see this done. So it looks coming out really great, and everything's gone really well. Harvest out the strip, and I've closed up the incision with sutures. You can see how clean this is. It's really just going to end up being a really, really thin line with hair growing through it. Right now you'll see the stitches, but once those are gone and it's hair, it's gonna be it's really gonna never be noticeable. Now the key to doing this like this is just to be super OCD, because if you're really OCD about making this perfect, it's always gonna be perfect, and it just takes time. A lot of places do this with staples, because it's quick. It takes 2 minutes to close this with staples, and I think it took me about 30 minutes to close this with sutures. I think that it's a lot more aesthetically pleasing when it's all healed, and it's just gonna look really great. The next step is dissecting all of the follicles out of that strip. We do that under microscopes. We have a team doing that. It's a lot of work to individually cut every single hair out of that, but that's what we do. And then once that process is done, we'll take all those grafts and we'll retransplant them. So we'll kind of have you guys follow along and see how the day goes. So I'm just making all the recipient site incisions right now. This is a really tedious process. I have to be really careful. I'm essentially making these sites in between the hairs where she has the thinning, being really careful not to damage the surrounding follicles. So it takes a really long time, and this is why you need someone that's really skilled doing this, especially for female hair transplant, because if you make these sites wrong, you can really damage a lot of hair and cause more balding than what the patient started with. So this process takes a very long time, and I'm doing it individually by hand, little by little, and we're going to do that through the whole scalp and all the areas I've marked off. And then once this is done, we'll take all the grafts and start placing them into here. We just finished our patient's surgery and everything went really well. We'll have the camera come in and zoom in here. So we put in grafts all the way from here out to the sides over there, and then all through this thinning that she has. And over the next year or so, this is gonna grow in. It's going to fill in quite a bit and make this a lot more full and a lot less noticeable. You know, female hair transplants are a lot more difficult to do. It's a lot harder to work with the hair, and you know, you're not able to shave the head, so it takes a lot more time to do them. I think this probably we're in about 7 to 8 hours on this procedure, but you know, it went well. Patient did really well, and she'll be pleasantly happy with the results. Last thing about this case, when this patient came to see me, maybe about 3 years ago, she had lost a lot of hair. And that was because she went to a practice here in Orange County that did experimental injections into her scalp. And when they did that to her, it ended up almost, I think it burned her scalp, and she had lost quite a bit of hair. So one of the things I talk about all the time is why patients need to go to people that know what they're doing. She should have never had any of those injections done, and it took a lot of time for her scalp to heal and get her hair back to the point where it was even now. So, you know, for patients watching this, it's really important you guys go to someone that does this on a daily basis. They know what they're doing, because if you don't, it's just here in Orange County. It's not like this happened in Mexico or somewhere, you know, far away. It literally happened down the street from my office, doctor doing experimental injections in her scalp to try to help her hair loss, and it went terribly wrong. So do a lot of research before you guys meet with a physician, know the things to ask, and if you guys have questions, reach out to us. Happy to help.